Hi, this is Jenny Bear of Living Well Dallas and Dr. Carol Villanueva of Living Well Dallas back at you, and we're going to talk a little bit about lab work. And so we do a lot of labs, and not necessarily in-house. We send a lot out. But for example, we were talking about FLT, which is first-line therapy, in our last video. What kind of testing might a person sort of need to go through? What kind of workup do you give people when they come see you guys for FLT?
Sure. So we call them our fancy labs, and there are fancy labs because they're very extensive. So not only does it have what we would call the routine traditional stuff, so liver numbers, kidney numbers, blood counts, but we're also looking in depth at cardiovascular disease risk factors. We look at some genetics, specific genetics that are may relate to how your blood clots, or how you have been affected, how your cholesterol is affected from your genetics, or
what's the B-methylation business that we're hearing about?
Yes, it's called the MTHFR gene, which is a hot topic in medicine now for several reasons. So it used to be something we only worried about in women with frequent miscarriages or blood clotting disorders or that sort of thing, and it does play a role there, but the reason why it's become a hot topic is the role that it plays with the neurotransmitters in the brain. So things like depression, anxiety, ADHD, which are all hot topics in the community right now. This gene plays a role in that, and how your body can detoxify from a genetic standpoint. So it's knowing your genes, and hey, we can't change our genes, but what can we do about it? What can we do, having that information to improve the way we detoxify, improve the way that our neurotransmitters work, so that we don't have to necessarily manifest it through disease. So it's exciting.
It is exciting, and you brought up something that I hear a lot of people say, well, it's the way my genes are. Like, that's it. I've got crappy genes. I can't do anything about it. Is that really true?
No, that is what we're learning, and that's what most of the current research is about. That it's a broader field in medicine that's being studied now, called nutrigenomics, but it's kind of how you can use food and how you can use nutrition to change, not change your genes, but change the manifestation of your genes. So this is truly fascinating and truly exciting from a cutting edge standpoint, and from a standpoint of, you don't just have to accept that my genes are crappy, so to speak. I can do something about it. I can improve the way that it manifests. I can know this and help myself stay healthy, or I can know how to raise my kids differently because of having this information. What do I need to make sure that do they need extra vitamin support in a certain area because of this gene, and so forth. So those are all things that we'll focus on through our understanding of your specific labs. And this is kind of how we sort of use the labs and your specific information, is how the lifestyle medicine program is truly tailored towards each individual. So each individual is truly biochemically different, so they're bio-individual, and this is where you hear that term personalized medicine come in, and through specific labs and following that, we can kind of gear things towards your specific needs.
Which is awesome. Because you'll tell a difference, especially if you know if you are a methylator, a good methylator or not. Then there's certain types of supplements and things that you take so that your body can actually break them down and use them. So the lab stuff is fascinating, and it's really fun. But we're going to move on to a new topic. So thank you for joining us in this section, and we'll see you in the next video.